the first question that is coming up is, I'll just take the first questions. Okay, as everyone knows, working with common biomedical treatment and disposal facility, we are actually handling waste generated from COVID-19 affected people. But till date, we are not covered by any government, either central or state, included us in 50 like medical policy. Okay. Two, for home quarantine disposal of non-disposable items should be used. Non-disposable items should be used. What to do if COVID care staff does not cooperate to run web app for COVID BMW? Okay, so if people are not collecting PPE kits used in graveyards, whom to contact, how to dispose of lab waste. I think the lab waste question was answered by Yutika before she left. I think both the antigen kit and the histopathology waste, I think she had answered this question. But yeah, I'll take it that, Pranav, will you like to take this question about your staff not being covered by adequate insurance or something? Is that something?
Sure. So this was a very prickly issue that came up initially. The government, of course, made a lot of statements and claims on people who should be covered, who should not be covered. Unfortunately, we did not come under those guidelines because we were private. We're a private company. So what we did was to incentivize helpers, drivers, waste personnel. We had to double their salary very, candidly, because if we don't step up to the situation, then we would have had, a worse situation. The government, of course, is looking at compensating us for a fee on a per kg basis. We're still in negotiation. That's just also not been finalized yet. But again, if not directly, indirectly, we're being given some incentive for collecting and disposing COVID waste.
Okay, so that's the this thing. It's a difficult issue. Is not easy to resolve. For home quarantine disposal or non-disposal items should be used. I think what is trying to say that we should not use too much of disposable item for home quarantine patients, because you can perhaps treat or disinfect many of these things. That is the point that is saying. Well, you like to say something to this, or for home quarantine patients, they are saying that we should not use too much of disposable. That's a suggestion. How does it work?
Yeah, well, as I mentioned, quite a number of things can be disinfected and reused again. Yeah. And so that could be a help, especially for people who, low-income people who cannot afford continuing to buy the disposable items. The important thing is, again, I think Ms. Puri suggested to make sure there's good segregation. And for the things that can be reused after disinfection, to make sure that they follow whatever are the procedures required for the disinfection. I mentioned the WHO guidelines on washing of linen and suggested certain examples of how you might be able to do it with using bleach and also using soap and water.
Okay, so that's the answer. If people are not collecting PPE kits at graveyard, whom to contact? I think Yutika from the CPCD gave 3 or 4 options for crematoriums as to what is to be done. It could be brought back to the hospital. It could be kept there. It could be, handled by them. It could be kept in a bag. So I think all those answers are there. Otherwise, you'll have to contact the nearest official or crematorium official or the urban local body, the municipality. I think they are in charge for the crematoriums. So I think this matter needs to be brought up to them to say that how it is to be handled. So I'll leave it at that. The next question that I would like to take up is a lot of questions. Oh, this is interesting, but I think the concerned person is not here, so I'll have to forward this question. There should be an edit option in the COVID-19 app. The app which is being used to record the waste generated by the urban local body and the hospital should have an edit option. Because I think what they're trying to say that if you make a mistake and report it, then we can't edit it. So that is a problem. So I'll forward this to Ms. Yutika, because I think she is the best person to take action, and I think I will request her to take action on this. Next is, what about barcodes for various BMW bags? Is it mandatory? But we have not found any vendors. I think it is absolutely mandatory. Can Pranav answer this question? Is it mandatory to use barcode?
Yes. So very clearly, it's mandatory. It depends on the type of nature of waste. If it is infectious waste or anatomical waste, you need to be in a yellow bag with a barcode label on top. The barcode labels are available through your biomedical waste service provider in your respective state. If they don't provide it, they will have a couple of vendors on their panel that be providing it. The cost is going to be anywhere between ₹1 to ₹2 per sticker, and it should be available through that network. If you're not, of course, able to get through to a biomedical waste operator, you can, of course, always send an email or call the state pollution board and the officer who's responsible for biomedical waste to create that channel for you.
Okay, the next question that is there with me is more of a solid waste question, and I think I will not like to indulge much in it, but I'll read out the question for everyone. Although there should have been a proper examination expert team for dumping sites, as I've seen how methane is generated in dumping sites, as these sites are not as per the scientific requirement. So this is a solid waste question, and it is for the municipalities to deal with it. I will not like to take up this question in the disposal and treatment of COVID waste, because this is, it borders on different thing. But yeah, solid waste is there. But the question of about how to dispose of solid waste at this point of time, there are very clear guidelines on how to dispose of solid waste, and I think that needs to be followed. What are the guidelines for sanitization workers, cleaning wards, and COVID labs? They should also wear PPE. For sanitation workers, cleaning wards, and COVID labs. For people who are cleaning, who are workers, sanitation workers, who are cleaning the labs and the ward, should they wear PPE or not? I think they should wear PPE. Is there any other different opinion? Would like to comment on it, Mr. Emmanuel?
Uh, I completely agree. In fact, I was very glad to see Mr. Tripathi's presentation on how all of his workers are well protected. All of the sanitation workers cleaning the wards and the labs should have PPE, definitely for sure.
Okay,
And they should
next
be
question
trained.
is,
They should be
yeah,
trained on hand hygiene.
sorry.
Yes.
Yeah, thank you. Absolutely clear that they should be wearing PPE. I think PPE is an absolute must for any sanitation worker. He could be working in COVID condition or non-COVID condition. He has to be protected by adequate and appropriate PPE. And if it is infectious waste or infectious lab that you're dealing with, you have to be wearing PPE. There are no any questions about it. Next question is, for asymptomatic patients, it has been decided to treat at home, fine, wherein the waste generated, both solid and food waste, will be disposed of the same way as they have been doing regularly. In such cases, is there any criteria or STG for treating such a standard operating procedure or something, treating such waste generated at home? So food waste and solid waste, which is being generated by asymptomatic patients, which is a general municipal waste, what is the protocol for managing it? I think the CPCB guideline is absolutely clear on it. Please go through the CPCB guidelines. It is to be treated as COVID municipal waste, which is to be taken up by the urban local body and is to be treated as municipal solid waste, it has to be treated with sodium hypochlorite, and they are aware of how to dispose it off. If there is a question on disposal, I think you need to just look up the guideline which is available, and there is no ambiguity in it about how to disinfect and treat the municipal solid waste which is being generated by COVID patients which were symptomatic or asymptomatic. Even in quarantine centers, if you are generating solid waste, which are municipal waste, which has been written like PET bottles, Tetra packs, paper, plastic, this is to be put in black bag and this is to be sent as municipal waste. They are not to go to the incinerator for burning, if I'm right. Pranav, would you like to this thing comment on it, please?
No, absolutely, sir. Uh, so the segregation guidelines by the CPCB are very clear as to what goes into a yellow bag, what goes into a red, blue, and white bag. Plastics, of course, have always been a part of the red waste. Initially, of course, when we started off, everything was coming in yellow. That was, of course, because people did not have the right training and knowledge on the biomedical waste rules. But with intervention from the CPCB and the state pollution control boards, we were able to correct that. So even if Mr. Sinha, of course, has all of our data, so you can see the trend as to how COVID waste moved from pure yellow to the other categories as well over a period of time, and how it's being maintained. The problem at our level was that, it was not from a segregation point of view, it was that red waste needs to be sterilized and autoclaved as the primary source of treatment. The disposal of that waste is through recycling. Now, when we were doing this and when we were in the thick of things, it was locked down. And there was no plastic waste recycler anywhere in North India that was willing to take plastic waste or COVID waste, plastic COVID waste, or plastic waste generating from COVID waste. So at one point of time, we had to store a tremendous amount of waste, after treatment and disposal, because there was nobody there to pick it up. So that is when, we kind of had to get into the recycling business ourselves. And, we have now invested in plastic waste recycling equipment, which converts plastic scrap, segregated plastic scrap, into granules, which can be put back into the recycling chain. So, this is again a learning from the difficult times that you cannot be dependent upon anyone during crisis. You have to fend for yourself. So,
okay.
Yeah.
Okay, so I think the normal food waste and other kinds of waste, I think it needs to be disposed of with the municipal waste, with the normal municipal waste. I think that's the CPCB guideline. Okay, the next question is, has anybody finalized the rates for COVID waste to CBWTF? Has it been finalized across the country for COVID waste? Are there different rates?
Okay, so I'll tell you the situation. Now, healthcare is a state level subject. It is not a federal or a national subject. So every state government, every state health department has to take their own call. So some of the states are the proactive, of course, came out with rates in the very beginning. They may have been exorbitant, from anywhere between 100 rupees a kg onwards. Some states did not take a call and they left it on the private operators to discover a price. And there were some states like us in Delhi, where after everything came through, is now we're talking to the government for a reimbursement or a compensation. So that's the problem. So there's no national level policy because health is a state level subject.
Okay. Thank you. I think we'll let's be very brief on our answers so that I think we finish up. There are a lot of questions.
Sure.
There is another question which septic tank is overflowing. Do we need to disinfect the content of the septic tank before evacuation or emptying the septic tank? What is the method? Anybody?
I have some suggestions. Uh, if you're disinfecting the toilet itself, you can use bleach. But the contents of a septic tank, if you use something like bleach, is simply going to be worthless because
Yeah.
the bleach is going to be completely degraded immediately by the organic matter. The important thing, if you're trying to clear out a clogged septic tank, is to make sure that the workers are protected by PPE. There is no data that I've seen that's credible of a transmission from feces to breathing, but nevertheless, because of the transmission through droplets or airborne, PPE would be important. But I think that's all that I think would be needed.
Okay. Then there is another one which is interesting is about home quarantine patients. They are sharing the same bathroom as other family members, and also clothes they wear become infected. Does simple detergent washing disinfect their clothes and spraying the sanitizer in commonly used areas? Yeah, so what do you do about the clothes that the COVID patient is wearing? How to disinfect it? And can they use the same bathroom if you have a small dwelling? There are more people. What do you do in such a situation?
Yeah. The ideal situation, of course, is for a COVID patient to have their own bathroom, but that's not possible in many cases. So if you're sharing the bathroom, I would suggest that after every use of the person who is sick, it should be sanitized using sanitizers in everything that could possibly been touched. Secondly, the air in the bathroom, if the bathroom has a window that opens up to the open air where nobody would be contaminated on the outside, it would also be useful to lower the amount of COVID in the air by maybe putting an electric fan or something on the window to blow the air out. That's another thing that's helpful. And then as for the clothes and so on, yes, you could add bleach that just adds as a level of safety, but regular detergent will inactivate the virus. If it could be washed in warm water, that also helps.
Okay, so that's very good. Uh, Sanitization tunnel was really required. Can we sanitize our outer body using mild solutions like HOCl? Is there any other organic material that can be used on the human body to clean the outer surface? Can we spray soap water on a human body to disinfect the outer surface? I think, yeah. Will you like to answer this? So two things, I think sanitization tunnel, and then how do we desanitize ourselves? Yeah.
Yeah. Um, the thing you have to balance there is how effective are the use of whether it's hypochlorite or I think later the person suggested hydrogen peroxide. That's one. How effective is it? Number two, what are the possible health impacts of using it? And number three, are there better alternatives? So in the case of using hypochlorite or hydrogen peroxide, there's the other issue of what are the impacts of having it in your skin and so on. They really weren't intended for that at the concentrations that they would work. And so my suggestion is soap and water. It's the safest, it's the easiest, and that's something that could remove things if you have to go through a sanitation tunnel.
Okay. Next question is it a good idea to disinfect PPE using plasma and hydrogen peroxide? PPE.
Yes. So in general, the concept of using plasma hydrogen peroxide, which is cold plasma, it's not plasma pyrolysis, that's a technology that was tested for the use of the N95 or FFP masks, the high efficiency masks, and they were found that they could work, but only for a certain number of cycles. After that, they degrade. All the other PPE, whether it's face shields and nitrile gloves and so on, either bleach or soap and water would be better than using something that's very expensive, which is the cold plasma hydrogen peroxide.
Another one is a small one, but then this was asked in the last meeting also. Comment on, how to disinfect paper.
Yes.
Especially office files and things like that.
Yes. If you looked at one of my slides, I pointed out that the COVID virus lasts for only 3 hours in paper, and that if you leave anything under the sun, usually in about 1 or 2 hours, 99% of any COVID infectivity is lost. And so my recommendation, if you're concerned about paper, obviously you don't want to wash it, you'll ruin whatever documents you have, is simply to leave it out in the sun, leave it there for a few hours, at least 3 hours, and that should be fine. That's all you have to do.
Yeah, thank you. There's another question which is pretty simple. Where will the gloves go, in red or yellow? If I am a skin specialist, only using it for consultations and no operation. I think gloves, if it is a nitrile or other plastic gloves or something made of any other material, it has to go in the red, because it has to be autoclaved before disposal, and it has to be mutilated, because it shouldn't be reused after that. So that's a guideline, that's a regulation on the subject. So we need to follow it. The last question that I take up on this, no, there's two questions I'll take up. Comment on reuse of triple layer mask.
Okay, I want to make two distinctions. There are the triple layer non-medical masks, which are used a lot by the public, and there are the triple layer surgical masks. Now, the triple layer surgical masks are usually very high efficiency, 95, 98% bacterial filtration efficiencies. They're triple layer because the outer layer is resistant to liquids. There's a special middle layer, which are the non-woven microfibers that as I mentioned, many of them use an electric charge, and then the inner layer, which is an absorbent. The second one, the medical surgical triple layer masks, if you try to disinfect them, they will not be of the same level of protection as they were originally. So then I would not reuse them for, say, the high-risk things that you do with working with COVID patients. Whereas the non-medical masks, which are used by the public and people in low-risk situations, those can be disinfected in the manner I had described, such as using bleach or soap and water and then drying out in the sun. And those can be disinfected properly and then reused.
Okay, I have the last question, and I think you'll have to take this on, Hooray. If the exhaust air is thrown out a duct system, what will be the management of this air? Other than HEPA filter, can be burnt out, or in what degrees of Celsius, and where do we put out the exhaust duct opening? That is another one. Considering a small standalone clinic of 150 to 200 square feet area. So if the clinic is so small, where do you put the duct? How do you throw out the air? And if it has to be captured, and if it has to be contained and treated, then what is the best possible way to do it?
Okay. Now, I'll make two distinctions. One is if you can renovate the clinic, one of the important things is to know where is the clean air coming and where does the dirty air come out. And you want to make sure that the two are not close to each other. I've seen people designing them so that actually what comes out ends up coming back in on the other way. So you need to make sure there's clean air coming out. And where it comes out, you want to make sure you're not focusing it on people living or working nearby. So you have to make sure you're putting it out that way. And people sometimes release it higher because there's more dilution. Now, the other thing to keep in mind is when you're also thinking about that, you also want to make sure that you're moving the air from where the patient and the professional is working and moving it away, not the other way around. In other words, you're trying to bring clean air from the clean areas out into a dirty area. Now, there's something that we call air changes per hour. So you can have a standalone system inside a clinic, but you need to know the air changes per hour, and they're usually different recommendations, usually around 6 in some cases, 12 in certain areas, and you need to be able to compute that. Many engineers can do that simple calculation, knowing already what your volume is, and in that way you can make sure you have enough air changes. Now, what to do with the equipment? if you have a duct system, one of the things that I have recommended and has worked, and I used to do research on this, is using an online ultraviolet germicidal radiation system. So that ultraviolet light doesn't affect any patients because it's in the duct, but then it's quite effective in killing and inactivating different pathogens. Secondly, if you're using a filter like a HEPA filter, it's important for you to then periodically change out that filter. And what to do with that filter? Most of that filter is made of non-woven plastic fibers. Therefore, if you looked again at the science, they will only survive on this plastic material for around 7 days at the most. Although I've seen one study that put it out to 10 days. So all you really need to do is just like CPCB suggested for some things, put it in a paper bag, leave it out there for 7 to 10 days. And by then the COVID would have died. Don't forget, a virus needs a host to survive. So it would naturally just die off. That's something to keep in mind. Now, if you want to speed it up, you can put it in hot water. You can put it in soapy water before you then discard it. But it's really not as complicated as some people might think.
Thank you. I have two other small questions, which I'll just, one is what about rural area solid waste management? I think it is a normal thing that you have on solid waste management. You have to innovate and adapt. Like we have already discussed, there is chemicals, there is heat, thermal, and there is soap. So these are all that forms part of chemicals. So you know, if you have some issues like that, you can use any bleach, or you can use hot water, or you can use temperature, or you can put it out in the sun. So you'll have to use a multiplicity of these things, because I understand that you're not being supported by a common waste treatment facility. Perhaps that's why this question is here. So you'll have to deal with some of these waste that is being generated in that manner. And some of the waste, as Mr. Hore has already answered, that if you just put it out in sun and some of the things in noon temperature for about 2 hours, the virus might not be as, it might get destroyed in that condition also. So you'll have to use a multiplicity of, options that we have discussed today. You will have to decide on what is the best way to deal with it. I think the other question which has been talked about today is no discussion on blue or white waste. I think we did not necessarily take up these two because they form the normal waste stream. One is dealing with sharps, the other is dealing with glass bottles. I think they all, if they're, even if they are contaminated with COVID or non-COVID, they will go into those bags and they will be transferred to the common biomedical waste treatment facility, and they'll be disposed of in a manner that has been prescribed as per the Biomedical Waste Rules 2016. So there is nothing extra on it, on blue and white, color-coded bags. As regards yellow and red, also the treatment options remain same. It is only the segregation which has changed a little bit, where we are saying that many of these plastic items need to be handled this way. They have to be segregated and they have to be put. Otherwise treatment options remain same. So it's just about a little bit of more safeguards, a little bit of more care in handling, in record keeping, in using PPE. I think these are normal things that we have to follow. Otherwise, it remains the same thing as biomedical waste. So I think this is what is, I think I have exhausted all the questions, and so I would like to say that if you have any other questions, please do write to us. We will be able to answer it to you, or we will seek experts to answer some of your questions, because if you have not been able to raise it in the time frame, you're most welcome to send it to us on the mail